The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, sitting with Barry Marin, who of course is Mr. Hypertrophic Cardiomyopathy, and he's contributed a couple of articles to a focus issue directed to hypertrophic cardiomyopathy that will appear soon in JACC. Now, one of the long-standing issues in hypertrophic cardiomyopathy has been the role of obstruction, left ventricular outflow tract obstruction. Barry, can you review this for us?
Yes, while obstruction is clearly an important pathologic feature of hypertrophic cardiomyopathy, as we see it today, the story through this 50 years of obstruction has been interesting and has been fraught with a lot of controversy, including suggestions at various times that obstruction did not even exist in this disease. But we know now, of course, that it is an important promoter of progressive heart failure and heart failure death, and there are interventions that can reverse mechanical obstruction and impedance to outflow, such as the gold standard, which is surgical septal myectomy, and the alternative in selected patients, which is alcohol ablation.
Now, imaging has played an important role in hypertrophic cardiomyopathy. Echocardiography, of course, probably being the clinical diagnostic modality of choice, but magnetic resonance is emerging and providing important information, isn't it?
Yes, echocardiography, as you know, began back in 1973, basically, and became the primary imaging test for this disease. In the last 5 years or so, it's clear that magnetic resonance has an important place in diagnosis because it is high resolution and tomographic, can actually visualize areas of hypertrophy which are not visible with two-dimensional echocardiography, and also provides the opportunity with the introduction of gadolinium to image areas that we believe represent fibrosis.
Now, is there a significance to detecting the fibrosis? Does it affect management?
That issue is unresolved at present and probably will be so for some time until the right kind of studies can be done in this low event rate disease to demonstrate whether the presence of delayed enhancement is a legitimate risk marker.
Now, a lot of attention has been directed to the genetic abnormalities associated with hypertrophic cardiomyopathy. Where do we stand there? Are we at a point where we really should be doing genetic testing in most of our patients?
No, actually, things have gone in the opposite direction. The fundamental use of genetic testing in hypertrophic cardiomyopathy is for diagnosis in family members in which the diagnosis clinically is either unresolved or unclear, or that there is no hypertrophy. So the original idea now, which goes back 20 years, that one could predict the future and prognosis with genetic testing has been pretty much abandoned.
Well, obviously there's an awful lot of information in this focus issue on hypertrophic cardiomyopathy. You and your son have contributed a great deal of it, and we thank you for that, and thank you for being with us for this interview.
My pleasure.
For the Genuine Article, I'm Tony DeMaria.
The Genuine Article. Discussion and commentary based on articles from JACC.